Doc, what are your thoughts on stem cells and what do you recommend them for? What about red light therapy as well as earthing? Thanks a lot, Jenny W. Well, that's an easy one. Again, at the risk of sounding like I'm plugging a book, I have an entire, I think it's chapter 3, devoted to stem cells, and arguably exosomes are included as well as Muse cells. Can be used, and I recommend it for just about anything. At some point, we're going to get an answer as to whether or not you could even use it for cancers or maybe just certain types. Right now, the argument is, well, it has some ability possibly to modulate the immune system so you could beat cancer, but there's also another camp that says that's crazy. And I would tend to err on this camp until proven otherwise. They're undifferentiated cells, which is what cancer cells are. Why would you add more fuel to the fire? They'll just take over and you'll exacerbate cancer. But other than that, yeah, they're great for regeneration, and most of us have a lot of degeneration going on, or some amount of it. And so examples, anything from obviously musculoskeletal injuries. You can put it in the joints, so cartilage repair, meniscus repair, things that you would normally use PRP for, platelet-rich plasma. You can use stem cells for. You can use it intravenously. I say, we can use it. In this country, you have to go back to the rule book. The FDA has been fighting this for a while. Mark Berman had a victory here in the Central District Court of California, which essentially lets us use autologous, meaning our own stem cells, if done a certain way, to treat ourselves. But now they're questioning whether or not we could use umbilical cord tissue cells. So when I say we can do this, it is possible, and it's certainly done in other countries. There are certain laws that keep changing here in this country. So anyway, sticking to the medical part of it, I guess I should say, we can use stem cells. Muse cells are thought to come about, to be expressed when we stress stem cells. And that's a whole other topic. But I bring it up because they're not teratogenic, meaning they don't cause cancer. They cross the blood-brain barrier, and they're way more potent, even though there are fewer of them. But they're more potent in terms of their regenerative potential. But okay, so you could use them intravenously, I was starting to say, and obviously that can go anywhere in the body where the blood goes and where there's contact with cells. And while first pass, we find that roughly 90% pass through the lung tissue and can fix that. The stem cells, the Muse cells, these exosomes, they know, speaking anthropomorphologically about the body, where to go. So 90% go to the lung. Oh, well, what a waste. Well, no, if there's no place to do a job, they'll keep moving and go somewhere else where they find a cell that's senesced, where it's damaged to the point where it needs to be replaced. Pretty cool. And we don't have to do anything but just like a monkey say, okay, here it goes into the system. I'm oversimplifying, but you know what I mean. It's pretty cool because the process is already set up. There's, for example, messenger RNA in these exosomes or in cytoplasm, or not. Well, they're yeah, in both. People think of them as in exosomes, but at any rate, messenger RNA will go to the via the blood to the bone marrow and say, hey, we have a problem over here. We have heart muscle damage. We need to make some stem cells to go repair the damage over here. There's also intercellular communication using that same mRNA, messenger RNA. And that's pretty cool that the body, quote unquote, knows how to do this already. And this is just our current understanding. We may find that it's contradicted down the road, or that there's even more to it that's even cooler, but this is what we believe happens right now. And just think about that for a second. So what can't you do with stem cells, right? To a large degree. I was talking to somebody last night who's studying with a very famous neurologist who is in his 70s, got into a pretty bad motorcycle accident that messed him up pretty good. And they used exosomes. I didn't get the exact dosage, but a bunch. And within a very short time period, a couple weeks or thereabouts, was up and running again. 70 plus years
Wow.
old, right? In a major motor vehicle accident where he was the, he was the motorcycle, so the motorcycle rider. As far as these other things, though, red light therapy. This is going to, well, first of all, there's not a whole lot of science, and it doesn't mean it doesn't work. Okay, but I'm just saying there isn't a whole lot of stringently applied science, which is what we like to see, right? Whenever possible, applied to red light therapy. Red light therapy, there are a lot of claims about red light therapy, about improving the skin, maybe growth of hair, maybe improvement of immune function, which is kind of funny because then they also say there's an antioxidant effect. But at any rate, I can't say we have a whole lot of proof. I could say that some of this makes sense because if nothing else, you get some improved blood flow typically to the area and more ATP formed in the cells. So there's a basis for believing it'll do something. And there's a lot of anecdotal reports from people that say it does, okay? But we just don't have the studies. And as a physician, as a scientist, it's my responsibility to say, well, here's what we know. And science is always a moving target, by the way, about what we know at the time. Well, I can't say that with anything but what I've said, which is mainly just anecdotal. So, and as for earthing, I mean, it's even worse in terms of the lack of data to support that, except anecdotal stories. And even the theory on that one's a little shaky. And again, please don't shoot the messenger. But, if you know enough about electricity, physics, and chemistry, you go, well, how's that going to make a difference? Whether I'm standing with on the ground, with or without shoes or whatever. I mean, there's plenty of exposure, like it or not, of the body to electrons, free floating about around the earth, so to speak, and in relationship to gravity and the poles and whatever you want to say that's used as an explanation behind it. So to simply take your shoes off to walk on the sand or the grass, it's kind of a dubious claim because what difference is that going to make? That's going to be relatively minor to what we're getting exposure anyway. Yeah, I don't want to burst any bubbles here, but it's part of my job, I guess. I'm not personally, I'm not that convinced with that. But again, there aren't studies, that's for sure, that are done well enough, both in design and in terms of the number of people. I think I looked into it a few years back. It might have changed, but you'd have a study of 16 people. Now that said, okay, for example, people will play down the power of placebo. I'm not suggesting that this is placebo, but there may be another mechanism by which this improves people's health that has nothing to do about with what's proposed as the mechanism. For example, well, COVID was a great example. They linked vitamin D levels with better mortality and morbidity related to COVID. Well, people who get out and exercise more and go for walks on the beach more are going to get more vitamin D, right? Because they're out in the sun more. Is it because of the vitamin D that they did better with COVID, or because they get out and exercise more? You follow what I'm saying? Mm-hmm. With earthing, my proposed mechanism would be, well, who doesn't do better by taking their shoes off and going to the beach and going for a walk, maybe with a loved one or a dog, or, well, that could be one of the same, I guess, on the beach or up in the mountain, just taking some time off, and that's going to improve your health. Again, this is one where with red light therapy, I can make a case for, it actually is the long wave therapy that's working. For the earthing, with the explanation I've been given with electrons or whatever the thing is, the grounding effect. Think about that one with your physics book open. I just I don't buy into the mechanism. Not to say it doesn't work, but by the claims about the mechanism, I can't follow. Anyway, hope that helps.
All right.
Ready?
Yeah.
So last question, glutathione. We did a 2 millimeter IV push yesterday. My question, doctor, is how many milliliters should one do at once? How many times a week for a professional athlete for the best benefits, and how much for a for a regular person as opposed to a professional athlete. So, okay, love glutathione. Okay, glutathione works best, arguably, with vitamin C. With vitamin C, you have to take care, if you're taking it orally, to make sure you're not at risk for kidney stone formation, which usually can be offset by taking some NAC with it, N-acetylcysteine. But be careful there before you just start taking a boatload of vitamin C. You can also sometimes, well, with kidney stones in general, just take some potassium citrate, but just do your research before you just start, as with anything, supplementing, just in case you're that one person that might be at risk. But when glutathione and vitamin C work well together because they can swap electrons with one another and recharge one another as necessary. Arguably, in combination, the best anti-bug, whether it be viral or bacterial or fungal even, that we can give the body that's not a drug. So a lot of good things to say about glutathione. It's also very protective when it comes to talking about a pro athlete or a regular person. It's very protective for hemoglobin. As a matter of fact, one thing, you just edit this out if we told the story before. I can't remember what we said about it or not, but did I ever tell you a story about I had all these athletes. This was back when I was riding with one of the teams, and I was the team doctor, right? Bicycle riding. So, we offered up some IV, Myers, and then follow it with a glutathione push. You can't combine glutathione with anything else because it reacts so quickly, so you have to push that separately. Anyway, we got all these guys we're following, and all of a sudden, mine included, we go from we had guys in 16 and 17 hemoglobin, and all of a sudden we're down at 14, 15, maybe even upper 13s. We're going, uh-oh. And I'm to the pharmacy going, man, did you give me reduced glutathione? What? I mean, they would give me anything else, but I'm thinking, what in the heck is going on here? Has to be the glutathione. What did I do? Because it's supposed to be protective of the red blood cell and hemoglobin, right? That's why an athlete might want it. One of many reasons. But anyway, I'm in a conundrum, and I tell everyone, stop, no more glutathione, right? And we'll draw again in a week or two. And then I'm on the horn with the MD PhDs at LabCorp, and the person who saved me from the misery of not knowing what the heck is going on was my old friend and professor of organic chemistry, Dr. Gagik Millikan. And I don't know why, I just trust this guy. He was the guy who never made a mistake when he was writing, Lewis structures on the chalkboard. I don't know if you remember those. It's something that you're going to goof up just because there's so many things involved in writing these structures on the board. He never made a mistake. The guy's just brilliant. And I said, well, let me ask, the answer is no, unless I ask. So anyway, he hears my story and then comes back to me a few days later. He calls me Randolph. He says, Randolph, this one's easy, And what it was, this is a sulfur-based substance. And the reagents they use to assay hemoglobin and hematocrit and red blood cells, etc., use a reagent that's also sulfur-based. So it threw off the measurement. Like biotin can throw off the measurement that they use. And who knew? I mean, measurements that's not something we learn in school. That's a laboratory thing. Who would even think of that? So anyway, it was lowering the value. It wasn't damaging the hemoglobin or the red blood cells or anything. It was just reducing the measurement, the assay of it. So, but all these people, these are guys, and nothing against LabCorp. I don't mean to say anything pejorative about them, but my old standby, my buddy Gagik figured it out. But these are things that can happen across the board. Why did I get off on this subject? Oh, simply because one might expect that. Be on the lookout if you're taking assays, getting a CBC and looking at these things. Careful, because you might lower it and you're going, what happened here? Am I developing anemia, or am I losing blood, or whatever the heck it is? Just know that glutathione can have that effect because of the way it's tested. But it's beneficial for both professional athletes and the average person, I guess you can call it. Typically, if I recall, glutathione takes about 4 days to metabolize. So arguably, I used to tell patients, athletes, once a week, come in for a Myers cocktail, we'll chase it with some glutathione, and you'll be good for the week. What I like about that is your body produces its own. This way, you've got 4 days of arguable suppression of your own because you're giving it to the body, and then you've got 3 days for the body to go, oh, okay, well, back to work. But to what dose? I mean, first of all, 2 mLs doesn't mean anything to me. With all due respect, I'm just saying we got to be a little bit more careful. 2 mLs of what strength, right? I believe the solution we were getting was 200 milligrams per ml. So that's 400 milligrams. I mean, that's fine. We got up to, or I certainly did, where, with a McKesson syringe, 10 ml syringe, you can actually fit about 12 mLs in there. So 2,400 milligrams without a problem. That's a hefty dose. And I've, again, this is anecdotal, guys, but for anyone out there who might be suffering from MS, I've seen some good results. Results meaning resolution of symptoms, what it's doing that might be beneficial or not, I don't know. But hefty dosages, like I'm just saying, about 2,400 milligrams or more of glutathione. Make sure it remains cold because the potency is somehow reduced apparently if you let it get warm. So it won't be pleasant. Some people, in other words, you go to some of these IV centers, and to make it cushy, they warm it before they push it or give any of the bags that they might be giving you. A lot of things that doesn't matter. This is one where you don't want to warm it. But for treating the symptoms of MS, at least, a lot of people swear by it. Again, look into it before you go any further, but just a heads up, it might be something to look into for anyone with MS. So when it comes to the question of the dose, I said how many times a week. I think once a week could be fine for the reasons I mentioned. And then how much you're willing to tolerate is up to you. A lot of times when you give yourself glutathione intravenously, by the way, you typically don't want to do it intramuscularly. You can get away with, say, 2 mLs, but it's like injecting lead. It definitely smarts. I remember I had a friend who's a massage therapist, a good friend of mine, and a great massage therapist. And her mom from Australia was visiting, and she got sick. And we thought, okay, we're going to help her knock this out with some glutathione. She was a hard stick, so we couldn't give her IV, and she didn't want one either, but she wanted just an injection in her bum. So I loaded up a 10 ml syringe. Big mistake, big learning lesson, because she had a knot there and pain for about a month, I believe. Yeah. Now, she's not the typical, but who cares? I mean, you don't want to do that to anybody, right? When you think you're trying to help them. And I think we did. I mean, she kicked her cold. It could have been from no help from the glutathione. Who knows? But you don't want to do it IM typically unless it's a very small dose. But IV, you can get away with a lot. And what I was going to say is when you start with an IV, start with a small dose. 2 mLs is probably fine. Some people will have an allergic reaction. Various things could set something off. Nothing major. So when I say allergic reaction, everyone who's getting an IV or every IV center or whatever should have a package put together in case someone does have an anaphylactic reaction, a really bad allergic reaction. But when I say an allergic reaction, like a lot of people get a stuffy nose. Sometimes that's enough to any reaction can make for an adrenaline rush. So just be prepared for that. So start with a low dose in case that happens, so that you go, okay, well, now I know what it is and I know what to expect, and it's not a big deal. Before you go to the dose that I was talking about using myself and with my pro athletes. That's all.
Yeah. And what was this? What was that dosage for the pro athletes?
Well, 2 mLs, if it's 200 megs per ml, that'd be 400 milligrams. I mean, I think that's pretty safe for anybody. You don't want to...
It's the starting dose.
You could use less than that, but you don't want to waste your time either if you poke yourself in the cubital crease in the vein. But again, working your way up to higher than that, I would do slowly. And I mean, we used to walk around the office. This is back when I was riding, and I used to be somebody, right? I can remember just pushing it. You could use a butterfly. Not that you need to hear this, so you can cut this stuff out. But I could put in my own because I use a butterfly, and then a long enough extension on the butterfly to hit a syringe that I could just slowly push while I walk around between patients. Okay, and get this done so I could get it done more often. And arguably, I mean, just to finish off with this one, I'll stop. But you could consider using it more often. Not on a regular, but say you do to talk about bicycles. Say you do a training block that's 6 weeks, and it's a hard block, and maybe 3 weeks is super hard, and you're doing climbing every other day or 6 days in a row, whatever it is. You could consider using it more then, perhaps. than others. But I think once a week would be fine otherwise.
Okay. Thank you, Doc.